Welcome to our comprehensive guide on suture materials. Sutures are essential in surgical procedures, serving as the threads that hold tissues together during healing. Understanding the different types of sutures is crucial for anyone in the medical field, as the right choice can impact healing and patient outcomes. In this video, we'll break down the basic classifications, properties, and uses of various suture materials, making it easier for you to select the best option for each clinical scenario. Let's begin by exploring the fundamental ways sutures are categorized. Suture materials are first classified based on their source or how they are made. There are three main categories: natural, synthetic, and metallic. Natural sutures are derived from animal or plant sources. Synthetic sutures are man-made using polymers, and metallic sutures are made from metals like stainless steel. Each type has unique properties that influence their use in different surgical situations. Understanding the source helps predict how the suture will behave in the body and its compatibility with tissues. Absorbable sutures are designed to be broken down by the body over time. These sutures are digested by body enzymes or hydrolyzed by tissue fluids, meaning they don't require removal. They gradually lose their tensile strength and are typically fully degraded within 60 days. Absorbable sutures are ideal for internal tissues that heal quickly, reducing the need for follow-up procedures. Their predictable absorption profile makes them a popular choice for many types of surgeries. Non-absorbable sutures are not broken down by the body. Instead, they remain in place, encapsulated or walled off by tissue. These sutures maintain their tensile strength for more than 60 days, making them suitable for long-term support or situations where prolonged tissue approximation is needed. Non-absorbable sutures may need to be removed after healing or can be left in the body permanently, depending on the clinical scenario. Non-absorbable sutures can be further divided based on their source into natural, synthetic, and metallic types. Natural non-absorbable sutures include materials like silk, while synthetic options are made from polymers such as nylon or polyester. Metallic sutures, often stainless steel, are used in specific cases requiring high strength. Each subtype has its own handling characteristics and clinical applications. Monofilament sutures are made from a single strand of material. Their smooth surface allows them to pass easily through tissues, minimizing trauma and reducing the risk of harboring bacteria. However, they require careful handling, as any nick or crimp can weaken the strand and lead to breakage. Monofilament sutures are ideal for situations where infection risk must be minimized. The main advantages of monofilament sutures are their smooth surface, which causes less tissue trauma, and their resistance to bacterial colonization and capillarity. On the downside, they must be handled delicately, as stretching or damaging the strand can lead to breakage. Proper technique is essential to maximize their benefits and avoid complications. Multifilament sutures consist of several filaments twisted or braided together. This structure provides excellent handling and tying characteristics, making them easier to work with during surgery. They are strong, soft, and pliable, which can be advantageous in many procedures. However, their braided nature can harbor bacteria and increase tissue trauma, so they are not recommended in contaminated or infected wounds. The advantages of multifilament sutures include their superior handling and tying properties, as well as their strength and flexibility. However, because they can harbor bacteria and cause more tissue trauma, they are less suitable for use in contaminated or infected areas. Choosing between monofilament and multifilament depends on the clinical context and the specific needs of the patient. Sutures can also be classified as natural or synthetic, regardless of whether they are absorbable or non-absorbable. Natural sutures are derived from biological sources, while synthetic sutures are made from man-made polymers. Synthetic sutures often provide more predictable performance and less tissue reaction, making them a preferred choice in many modern surgical procedures. Some sutures, such as polyester sutures, are coated with a biologically inert, non-resorbable compound. This coating acts as a lubricant, reducing surface friction and making it easier for the suture to pass through tissues. However, the coating can also make knot security more challenging, so special knots, like the surgeon's knot, may be required to prevent untying. Surgical threads are also classified by their diameter or thickness. The sizing system ranges from 1 to 0 to 10 to 0, with higher numbers of zeros indicating thinner, more delicate threads. Choosing the right diameter is important for matching the suture to the tissue type and the required strength, ensuring optimal healing and minimal tissue trauma. Metallic sutures are made from materials like stainless steel, tantalum, gold, or silver. These sutures are extremely strong and are used in situations where maximum support is needed, such as in bone or sternum closure. Their rigidity and resistance to infection make them valuable in specific surgical contexts, though they are less flexible than other types. Let's summarize the main types of suture materials in a simple table. We have absorbable and non-absorbable sutures, each of which can be natural, synthetic, or metallic. Within these, there are monofilament and multifilament options, as well as coated or non-coated varieties. This classification helps guide the selection of the most appropriate suture for each surgical need. Selecting the right suture material depends on several factors, including the type of tissue, the required strength, the risk of infection, and the need for long-term support. Surgeons must weigh the advantages and disadvantages of each suture type to ensure the best possible outcome for the patient. Understanding these classifications makes the decision process more systematic and effective. Absorbable sutures are commonly used for internal tissues, such as the lining of the stomach or intestines, where removal would be difficult or unnecessary. Their ability to degrade naturally makes them ideal for these applications, reducing the need for follow-up procedures and minimizing patient discomfort. Non-absorbable sutures are preferred for skin closure, cardiovascular surgery, and situations where long-term support is necessary. They provide durable strength and can be removed once healing is complete or left in place for permanent support, depending on the surgical need. Monofilament sutures are especially useful in contaminated or infection-prone areas, such as the urinary or biliary tract, because their smooth surface resists bacterial colonization. Their use helps minimize the risk of post-operative infections and supports better healing. Multifilament sutures are chosen for their superior handling and knot security in clean surgical fields. They are often used in procedures where ease of use and reliable knots are essential, provided there is no significant risk of infection. Coated sutures are selected when reduced tissue drag is important, such as in delicate or vascular tissues. The coating allows the suture to glide smoothly, minimizing trauma. However, surgeons must ensure knots are secure, as the coating can make them more likely to slip. In summary, suture materials are classified in several ways: by source, absorbability, filament structure, coating, and diameter. Each classification helps guide the selection of the most appropriate suture for a given clinical situation. By understanding these categories and their implications, healthcare professionals can make informed decisions that promote optimal healing and patient outcomes. Thanks for joining us in this overview of suture material classification.